Hello everyone. So my name is Ravi, and in this video I will be talking about medicals of SSB. So medicals is quite time-consuming task, and sometimes it takes more time than your own SSB. So there are five major departments that need to be cleared to be declared fit, and they are dental, ENT, eye department, medicine, and surgical department. So one by one, I will telling you about my experiences and what are the things that are checked or that I examined in these department. So let's begin. I have also attached the links for the medical standards of Army, Navy, and Air Force in the description. So just check it out in case you have a detailed, you need some detailed information. So for the medicals, you will be told to fill 4 or 5 forms, and each form will have the option for each department. You will pasted photos, and your identification mark will be written, and those identification mark will be will be with you for the whole life, as it is written on the ID card of the defense forces. So for my first day, I went to the dental department. I was checked for my dental points, cavities, and other things. And I was told that most people do not get rejected in this department, and most people have the required laid down procedures. So this is how my dental department went, and it hardly took less than half an hour for the dental checkup. So I was declared fit in dental one. After that, on the same day, I was told to give my blood and urine samples that would be used in the medical medicine department. So on the first day, I gave my blood, urine, and also my chest X-ray. That is also would be used in the medicine department. So this is how the first day of my medicals went. Person who was responsible for me had taken the appointment for the ultrasound, abdominal ultrasound, and this is also to be used in medicine department. So on the second day in the morning itself, without any breakfast, I was told to report to the ultrasound, and thereafter in 1 hour or so, my ultrasound were done. The report, although got the report later, but I was declared for in the ultrasound, so nothing abnormal. So on the second day, actually, if people were having their medical conference, so I waited for them, and nothing happened on that day for me. So on the third day, we decided to go for the eye testing or ENT. So for ENT, the ENT was quite quick as well. In ENT department, there will be a person who would be holding a placard and will be revolving his fingers around your ears, and someone will tell some numbers, and you have to repeat it, so just to test your listening skills. So after that, I was checked with my throat, my nose, and any other abnormalities I have in ENT. So I was declared fit as well. They and all the people who were with me were all declared fit in ENT as well. So this is how my third day went. On the fourth day, there was some kind of that the eye department has their operation theater day, so that they were busy, and medicine for the medicine as well. People doctors were not there, so I was not able to do anything on fourth day. So on fifth day, we went to the eye department, and my eye was checked, my powers were checked, my vision was checked. My vision was 6/12, so that is the laid down procedure actually for the Navy, 6/12. And also for color blindness, they will put you in a dark room for 10-20 minutes, and they will show you some colors, red, green, yellow, and they will ask you to tell the colors. So this is how the color blindness is checked. So I was declared fit in eye as well, although for the eye I was called again for the next day just to check my vision. Actually, in the eye, you will few drops would be given to your eye just to loosen the ciliary muscles to check the cornea. So that's why I was called next day to check the vision, and I was declared fit on the next day. So for the medicine, I went. So the next department was medicine. So in the medicine department, uh, first thing that all the reports like blood, urine, and ultrasound. They were checked. The doctor had a good eye on those results, and for my case, all the results were good. There was normal. So he checked my heartbeat, my pulse rate, and those things, height, weight ratio. I was overweight by 2 kg, so he just told me to reduce the weight by 2 kg before going to the academy. So I'm doing those things. So all those things were checked, and then again heart heartbeat and all those things, complex things I don't even know what he was checking. And he told me to just walk in a straight line with your eyes closed, with your eyes open, and few things like that. So that is how my medicine department went in. And actually, for the surgical department, that is the next department I'm talking about. The medicine department is mandatory before the surgical department. So before going to the surgery department, you have to be cleared fit, or you have to be done with your medicine department. So on that day, the day was over. So on the last next day, for the surgical department, there was. I must tell you that I'm telling you in a very simplified way, but you will need to wait a lot. You will be given the last priority in those things. You will be given the. In fact, it is written in their procedure that emergency patients, and then OPD, then officers, and something like this, and then the SSB candidates. So you will be given the last preference, and when all the patients are done, you will be checked. So this is why this procedure takes a lot of time. For the medicine, I waited for from 9 in the morning to 1:45, and then at 1:45 I was done with my medicine department. And similarly, other things like ENT, eye testing, and those things. So it is taking a lot of time. It will be real test of patients actually. So for the surgical department, I think there's a more kind of a surgical department is very famous for getting a lot of rejections. So surgical department main purpose is to check the body structure. If there is already a surgery or something like this, or some abnormality in your body structure, like flat foot, knock knees, carrying angle, tennis elbow, something like this, and also your private parts would be checked. So in my surgical department, I was made to wait. After going in the cabin, I was made to wait 5 minutes in the very chilled AC. So I was nude. I was stripped with my clothes just for the checking. So after that 5 minutes, I was called. My flat foot was checked, my knock knees was checked, my carrying angle was checked, and then he checked my private parts by opening the skin and those parts, and then he told me to turn back, and he checked for piles. So these things went by, and the last he just asked me, where are you from, and all those things that mostly all the doctors will ask you, and they will just wish you a good luck. So after that surgical department, in the same day itself, we tried to get the conference. So in conference, medical conference, there will be a set of three doctors that is appointed by the hospital itself, and they will review your result for all the five departments, and they will just mark you for the fit or unfit. And if you are unfit, you will be told about the procedure of the next. You will told about the next procedure, like appeal medical board or review medical board. So those things were not applicable for me. I was declared fit for all the departments, and just they wish me luck and goodbye. So that is how actually I again I tell you that I told you in very simplified manner, but my whole things went for 8 days, and in that 8 days, 2 days were completely useless because some of the doctors were in OT or inspection kind of thing, and also the COVID had just started, so they were just taking precaution and only allowing few people. So this is how my medicals went in, and I was declared fit. So I'm just waiting for merit list and appointment letter. So that's all from my side. Thank you and all the best to everyone.